Today's episode contains sensitive material on the topic of mental health, specifically relating to infertility, and may not be suitable for everyone. Information shared is based on personal experiences, and it's not meant to replace medical, psychological, or other professional help.
They've come up with a really good estimate, which is that 1 in 6 people have experienced infertility at some stage in their lives globally. So it's about 17% of people worldwide. There's a constant reminder of what they're not able to do. So family functions, friends having children, all those things that they once would participate in and receive support from and be beneficial now become painful reminders and they move away from them.
Hi, everyone. I'm Kiran Prasad. Welcome to the Uprooted by Unwanted Change podcast about managing life transitions. On each episode, we focus on a topic of unwanted change with a story of hope and resilience for navigating through it. Together, we'll discover a community of inspiring individuals and create a system of support for one another. This week's episode is Uprooted by Infertility, and it's such an honor to have Dr. Brennan Peterson, one of the world's leading experts on the mental health implications of it. I was introduced to Dr. Peterson through my daughter, who speaks so highly of him as her professor on her therapy program. Welcome, Brennan. I'm so glad to have you join us today.
Thanks for having me as a guest on your podcast. I'm really excited to be here.
I'm so excited you're here. Let me introduce you to Dr. Peterson. Dr. Peterson is a professor in the Department of Marriage and Family Therapy at Chapman University in Orange, California. He's taught graduate and undergraduate courses there for 23 years, and he's also a licensed marriage and family therapist. Now, he also researches the mental health implications of infertility and examines how couples cope with this unexpected life transition, which is what he'll be talking about today. He has published over 50 peer-reviewed journal articles and book chapters, which have been cited over 5,000 times. Wow, that is really impressive. And he's also a very engaging speaker, presenting his work not only in the US, but worldwide in countries like Israel, Canada, Europe, China, Hong Kong, and Australia too. Now, Brennan, I am absolutely in awe of your expertise on this topic. I, on the other hand, know very little and couldn't even begin to imagine what it must be like to be in the position of the people you research and you see in your therapy sessions. Because I'm someone who has always wanted kids, and I was fortunate enough to have them. I'm so grateful. And many of you listening may feel the same and not know how to relate to family or friends going through such a major unwanted change. While for some of you, the challenges that come with infertility are only too real. Either way, I'm sure we are going to learn so much from Dr. Peterson today.
Yeah, thank you so much for that really generous introduction. It really is a special topic to research because it's so real for people. A lot of times people can research topics that don't feel as applicable to real life and real world settings. And that's something that really drew me to the topic. It was something where we really had a chance to reduce human suffering, which is important to me.
Yeah, that was my first question. I know that you and your wife haven't personally been uprooted by infertility. So, what then first sparked your interest in this field and what's continued to fuel this passion?
I was in a master's program, much like your daughter, in marriage
Hmm.
and family therapy, and it was in 1998. And I needed to write a paper on something to do with a couple that had systemic implications, where it was relational and some kind of stress that they would experience that would have mental health outcomes. My wife and I at the time had friends who were going through infertility, and we were really young at the time and didn't know much about it. And my wife suggested and said, "Hey, our friends are going through this. Is there anything written on it? I had no idea. So I did a search and found my first studies on papers on it. I wrote a paper about it and did a literature review and just really connected with the topic. Then one thing led to another, and it became my master's thesis. It became my doctoral dissertation. And then at getting a job in an academic university, you need to have a research track and a focus. And I'd already established that, so I just continued on, and it became something where it's been really important to like look at all the different facets of it. There's so
Mhm.
many things that happen during infertility, and there's so many areas that you can examine in the psychological implications of it. So it's just been a really powerful topic to research. And then there's just so much good that can come from it because it is something that produces so much distress and destabilization. And like you said, people feel completely uprooted when they experience this.
Yeah, that's such an interesting story, knowing the background behind what fueled this. And so, I would love to know, how would you define infertility?
So medical providers define it by it being a like a failure of the reproductive system. And the World Health Organization recently came up with a way, and they included that it's a disease of the male or female reproductive system. So they've added in the male system, which is excellent because so for so long it's always been kind of uh, overly blamed on females. So it comes down to it's a failure of the system after 12 months or more of regular unprotected sexual intercourse. Some physicians will actually decrease that time frame from 12 months to 6 months, depending upon age. Like if a woman is over 35, but the standard definition is the 12 months.
That is so interesting to know. And also, I love that you added how now they've included the male female system, and because it's always the females who are typically blamed for this in the past. That's good to know. So, what is the likelihood of someone being diagnosed with infertility worldwide, like the comparison, and what are the differences also between men and women? If you could share some of that data, please.
Yeah, this is where the World Health Organization is also really helpful. And getting a global infertility prevalence estimate is really difficult because they're pooling together all kinds of different countries and it's really hard to know precise numbers. So some of it's based upon like estimation models, but they've come up with a really good uh, estimate, which is that 1 in 6 people have experienced infertility at some stage in their lives globally. So it's about 17% of people worldwide. It's the same in high income countries and low and income countries. There is no real difference. And then there's for men and women, like we said, that it's traditionally been viewed as a woman's problem, and males contribute to infertility half the time. So if you really break it down by sole factors, for female factors, it could be about a third of the time. For male factors only, it's about a third of the time. And then there's about a third of the time, it's a combination of the two. So it really is something that's shared between the couple. And when I did that research as a master's student, that was the one thing that was really powerful was that the couple, like how they both interact and respond to the problem, not only impacts their individual functioning, but it impacts how their partner experiences it. So that's why it truly is like a couple's stressor and a couple's phenomenon.
That data did surprise me. I think it was a bit higher, 17%. That was higher than I was expecting it to be. Other than age, because a lot of people know about age affects infertility, and what are some of the main causes of infertility? I know that endometriosis can be a cause.
Hmm.
I myself suffered from it years ago, but luckily for me, I'd already had my children before then, which I'll always be so grateful for because I just shudder to think that if I couldn't have had kids. So, what are some of the other causes other than age?
For women, ovulation problems are the most common, and they're also the easiest to treat. Tubal problems are common. Uh, Problems with the uterus and implantation And like you said, with endometriosis, that can affect that. And then lifestyle factors can impact it as well, like smoking, STDs such as chlamydia, BMI, being underweight or overweight can affect fertility. For men, it's going to be about low to no sperm count or low sperm motility in terms of their movement. They don't move as they should. Testicular tumors, sperm duct defects, impotence can cause infertility, and then environmental toxins, and then those lifestyle factors, smoking, alcohol, weight, those are related as well.
I didn't know most of those. I knew some of those. Yeah, that is extremely interesting to learn about. And the weight, underweight, or overweight as well, did you say?
Yes,
And
both.
by how much? I mean, people might be wondering, like, how underweight or how overweight.
I think they use BMI and they'll look at like severe underweight, severe overweight. That would be, I think, what it would do. And oftentimes that affects ovulation and it can affect sperm production as well.
Most people, I think, know about sperm production, but all these other things, wow. And lifestyle changes or lifestyle affects it.
Some of those things are modifiable factors, right? They can have an impact. And then some of those things are modifiable through interventions. And then some of those things may not be modifiable. So it really kind of depends. Like if a man has what's called like azoospermia, like no sperm count, there's really nothing that they can do to to help with that. So there's advanced reproductive treatments that can potentially assist, but you may need to look into other options at that point. So some of those things can be, I think this is one of the things, and I know we're going to talk about the psychological challenges with infertility.
Mhm.
And one of the things that precedes that is that people don't have total control over fertility. So there's certain things they can do, but there's a large scope of a lack of influence where you just have to accept kind of things out of your control, and that can be really difficult for people.
We understand that on this show because really, with any major unwanted change that causes stress when you can't control things. So, what are some of the greatest mental health challenges couples face after an infertility diagnosis? I mean, I'm guessing coming to an acceptance of the diagnosis itself must be so hard. And we're so fortunate because you can wear your researcher hat and your therapist hat as well on this. What
Mhm.
are those greatest challenges?
The largest challenges are really going to be how it affects their development, and oftentimes we consider infertility as a developmental interruption in their life course. So they've oftentimes been planning, considering they assume that they can have a child. When we talk about control, it's a little bit of an illusion of control because we believe we can control fertility through contraception, and we can. You can limit it, but there's the inverse belief, which is that, oh, well, if I am not doing that, then I can control getting pregnant, which people can't. So this developmental interruption is so surprising for people. And that's why it's this sense of being uprooted. It's a sense of their roots are actually just getting started. They become a couple. They might have worked on their relationship for a time, prepared with the education, or just thought about like, okay, we're ready to have a child together, and let's try. And then they experience this roadblock that feels completely surprising, and then they're thrown into this world of infertility, which they never knew really existed, and it's so complicated. So that initial shock and distress is, I think, one of the biggest things that happens. Then there's a very long journey where this can affect their identity formation, how they view their femininity, how they view their masculinity, and the corresponding distress that comes with that emotionally. It can result in worry and anxiety about the future. It can be present from depression and loss, and it can manifest through a loss of social connections and friendships. So people have a really hard time being around other people who are in that stage of life, or they're moving into that stage of life, or there's a constant reminder of what they're not able to do. So, family functions, friends having children, all those things that they once would participate in and receive support from and be beneficial now become painful reminders and they move away from them. So it's a double loss that they lose that sense of connection to their friends, and then they lose this sense of, I'm not able to participate in that myself. Finally, there can be stress on the couple's relationship, where a lot of times that's the thing that really upholds people. And they enter into this journey together where they say, okay, we're a team, we can manage this joint stressor together. But over time, if it's really stressful and unexpected difficulties along the way, it can result in strain on the relationship. And then it becomes much more difficult. And then they feel even more alone. So when you take all those together, you can see how really stressful and isolating and lonely this can be for people.
Well, that's a lot of challenges they face. The developmental interruption. I love how you described it as a illusion of control because of contraception. You feel you have that control, and the social challenges they face, the double loss, made me think of how many of us. I know I'm guilty of doing that. We shouldn't assume either that people have always wanted kids or that they can have kids because one
Yeah.
of the first questions I have to hold myself back and remind
Hmm.
myself sometimes. And I'm sure a lot of us, like one of the first things when we're getting to know new people, oh, do you have any kids?
Yes.
And that must be such a painful question for them.
Yeah, that's such a good point because there's so much of this is just built into our society. So if you're in a pronatalistic society where childbearing is encouraged and it's normalized, then that is part of the conversation, like you're saying. Or people that become a couple and then they get married, and after a few years, it's going to be common where people say to them, "Oh, well, it could be a very curious question like, "Oh, are you going to have kids?" Or it could
Mhm.
be more of a forceful kind of from a relative like, "Hey, when are you going to have kids?" Those things might just be easy to roll off the back of someone who's planning on it and who hasn't started trying. But when someone is really in that place of going through infertility, those kind of questions become so unwanted. They're so painful for people because they feel misunderstood and they're losing those connections. So there is certain things that I think if we're trying to provide support for people that are going through it, there's certain things we can do and certain things that we shouldn't do and probably are worse. And that would be one of them, like unsolicited advice. The classic one is that maybe you should just relax or you're so stressed, take a vacation, take a break. I think most people know that that's not helpful anymore.
Yeah.
Um, but another phrase I've heard people tell me that it's hard for them to hear is when someone says like, "Oh, things will work out for the best," or "This must be for a reason." And those are well-intended comments, right? Those are uh, people really want to help someone going through a struggle. They see them in emotional distress or pain. They probably just don't know what to say to them. And so they want to come up with something encouraging. But I think where it falls short is it misses the mark for most people in that situation. And they don't know that it's going to work out for the best. And sometimes it doesn't work out where they don't have a child. Like when people go through treatments, there's some data that suggests that 30% of people will end up without a child. So about like maybe 60% of those who go through treatment will, about 10% will adopt, and then about 30% don't have a child. And so that's a whole different transition for them.
Yeah. Wow, there was so much there, so many gems there, Brennan, that you shared. And it brought up something for me when you mentioned about the family culture pressure, unsolicited comments, because I still remember as a new bride, I was at a family function and there was some friend of the family I'd never met before, this lady, an older lady. And in my Indian culture, there can be more pressure as well on
Uh-huh.
this. And she came up to me and she patted my belly and said, "Oh, is there nothing in here yet?"
Mm,
I'll never forget that comment. And imagine how much worse if someone was really trying and couldn't.
yeah. Yeah. Sometimes that's such a high level of intrusiveness for people. And like you're saying, right there, it can catch people so off guard, and it can,
Hmm.
when you see you'll never forget it. Those are
Yeah.
linked with these strong emotions, and uh, it that's kind of crossing the line for people. So when to be supportive, I think that we just acknowledge our limitations in what we know, and that we don't fully get how hard it is unless you've gone through it. And even if you have, you're probably having a different experience than them regardless. And so it's acknowledging that, but then inquiring from them, what is it that you need to be supported? I'm gonna do the best I can, but I don't know what that is. And it gives people some level of control where they can say, this is what I'm really needing, instead of it being just things that are offered to them that are unhelpful.
Like you said, to reiterate that people often, they mean well, I think, but they often don't really know what to say.
Right.
And with this kind of a topic, they pull away. Like you said, they pull away from people. They feel awkward and uncomfortable. And this follows on, I think we kind of touched a little bit on it, if you want to say more on this, about stigma. Firstly, do men and women experience that? They both experience that stigma of infertility. How is infertility stigma related to the mental health challenges we just discussed?
That's such a good question. We just did a recent study about stigma, and it's such it's almost a universal that people experience, and it varies by culture as well. So it can be greater and a little bit less. But most of the time when people feel that, it's a sense that the experience that one is having differs from what other people are having around them. And there's some kind of unfavorable characteristic that they're experiencing that gives them a sense of like otherness. So, and then they're open to judgment or criticisms from others. Then it results in an internalized stigma, which then becomes like self criticism and feelings of inadequacy. So, and sense of devaluation of self. So it's more like, man, I am different. I am defective. Why can't I do this? I'm less than. And when that happens, it heightens all of those things we talked about. So depression goes up, distress goes up, finding meaning in life goes down. So all those things that are protective and that are beneficial are harder to access because of stigma. There's almost like a fear, like a feeling humiliated, sense of feeling kind of cast out of the social circle that people are in. It is for men and women. When you read these quotes and studies that people go through, it's so painful for people, where they'll say people kept asking me about this, or the circle of friends that I had, uh, they just kind of pushed me out, pushed me aside because I wasn't fitting into this norm. I felt excluded. So stigma has so many levels to it, but it's always painful for people because they're pushed to the outside.
Oh my gosh, how sad that all is, that feeling of otherness, of being outcast, devalued, and feeling for them to feel defective, because as we spoke about it, the causes, those aren't things they can control. They might be a
Right.
little bit lifestyle, whatever, you can do a few things, but majority of the time, these aren't things within your control, and to feel that they're somehow defective.
Yeah, you're totally right. And that is something that people really struggle with, because when that internal self-criticism comes on, it's that, I somehow have failed. Whether it's my body has failed me, or I'm failing my partner, I'm failing my family. And when those internal dialogues become strong, it just increases distress so much.
Mhm. Okay, so for the next part, which I'm sure will be so useful to a lot of people, is the finding support and some practical coping strategies, which you are ideally placed to help us with all this. If someone in our life is facing this, how can we best support them? We've heard the things we shouldn't say or maybe should avoid doing. I would really have no idea how to do this.
I think the biggest thing is that we want to find out individually from that person what is unhelpful and what is helpful based upon their need, and an acknowledgement that we may not know, but that we want to help and support them. And I think if we come at support from that perspective, it provides a pathway for that person to feel like they can express what they need, because there's a sense of openness on the other person's part,
Hmm.
rather than a sense of, if the person comes and let's say a family member says, you're just being so sensitive, why can't you be happy for your brother or sister? They're having a child, like, you're being selfish. When there's kind of shame and expectation that's linked, then the person withdraws no matter what. So if there's a sense of openness to say, I realize that this is really hard for you and I don't fully get it, but I want to. And what are the ways that I can best support you? Because they
Mhm.
might be needing some space. They might be needing someone to just hear them and let them feel something without fixing it. Or they may need someone to problem solve with and to get a new perspective from. That person might not even know what they really need from support, but at least there's a potential that that relationship can provide that. So once they get more clear, that person might go and have some counseling, or that person might be reading a book and they might say, this is what I really need. And that they have a trusted person in their life. So I think it's really the way we can best support someone is being a trusted person to someone else where they can feel what they need to feel. They can, we're not going to impose and judge, but rather we're going to be accepting, we're going to be supportive in the way that they need. And that's really going to make a difference.
That's really helpful advice. And I didn't even think of what it must be like in a family when your sibling is having children and then you've got the
Yeah.
pressure from the family. Oh, why can't you just be happy for them? And
Yeah.
people not understanding what they're going through. And that's so important. The trusted person who's non-judgmental. I mean, we need that in every facet of our life when we're going through any struggle. I think it's so vital that we all have that.
And that can be tough for people to do, right? Because it impacts these, like it impacts holidays, it impacts like family traditions. And a parent may be dealing with, they're like, oh, well, why, my son or daughter and their spouse, they're not coming home, and I'm upset about that. Rather than it being like, okay, let's find out like what's happening for you. And so that's, I think it kind of just impacts so many different areas of life. And so that's why I think it can be more, there's more judgment and more quick decisions about it, about, hey, why can't you just get over this? Or I know it's painful, but and that's what's
Mhm.
unhelpful.
Yeah, and when we were initially having our chat, you'd mentioned also something about, and it never occurred to me again, that times like even like going to the park.
Yeah.
Going to the park is difficult for someone facing infertility.
Yes, people will modify where they walk. They won't go to the grocery store at times when they used to go. If there are a lot of children, they'll go at night, because these things become painful reminders. And so any kind of trigger like that, people start to avoid. And avoidance is one of the things that in the short term it can be helpful because it's a protective mechanism and it can help people kind of find some stability. But long term, it doesn't help because it creates a cycle of what we call like experiential avoidance, where people aren't willing to look at and feel what they're normally feeling. And it also just creates a sense that they are not in a position where they can cope with what they're experiencing. Avoidance is a short-term strategy, but we don't want it to become long-term because it's not going to serve them in the end. It's going to keep that development stuck, and we want to find new pathways for development.
Mhm. I did not know that about, even the time that they go to the grocery store. I didn't even think of things like that. It would have never occurred to me that that would be painful for
Yeah.
them. And so now moving on to what are some scientifically proven coping strategies that you've successfully used with your own therapy clients? I know mindfulness is a big one for you, and that's something we really share. We both share a passion for mindfulness. Your unique perspective is so great on this because you can speak on the research as well as the client side of the actual coping.
Yeah, I would think about it as strategies at three different levels. So at one level is the individual level, then the second level is like a relational level, and the third level is at a social level. So if we start at the individual level, I believe, yes, mindfulness can be a really important coping strategy that people can use. And the reason it's really powerful is because it combats that avoidance that we just talked about. Because mindfulness is about turning towards something, it's about accepting something as it is. And it's also about learning to replace judgment and self criticism with self-compassion and understanding. And those are really powerful tools for people. They're difficult. They're not easy. Mindfulness is not a um, strategy that's like, oh, I need to relax, so I'm going to use a mindfulness strategy. You can use breathing exercises that might help with that, that are targeted specifically for activating the pathways for relaxation. Mindfulness is more about awareness, and it's more about what am I experiencing? What are the thoughts I'm having? And then how is my relationship to those thoughts and experiences either enhancing what I'm feeling and or getting in the way of what I really want to be doing with my life? So that's a really big one. And then anything that helps us move towards at that individual level, like expressive writing can be very powerful for people, like journal writing and discussing what it is that they're experiencing, writing about things like their anger and how it's unfair and how they've always wanted to have a child and now they're not able to. Why are people able to have children who don't want children? And why are there people in the world who have children who neglect them? And writing about this sense of, it challenges these deep beliefs about life. Like I want to do something where I can love and nurture, and I can't do that. I'm kind of denied that opportunity when other people can, and they squander that opportunity or they make life worse for children. So that could be a powerful way, or any kind of expression, like it could be expressive art, anything that helps at an individual level. At a relational level, I think receiving support from a partner and also giving support to a partner is important. And that can come in the ways, let's say, like joint decision making and problem solving. There's so many decisions people have to make. They're thrown into this world of infertility and doctor's appointments. They have to make decisions about, do we want to pursue treatments? Is our insurance covering this? How are we going to pay for it? There's the stresses associated with it. If we have and go through IVF and we have embryos that we don't use, do we freeze them? And then eventually, how do we use those embryos and what do we do? So there's very complicated decisions that are required of people, things that they probably haven't even thought about, the ethical considerations of what they consider life and what they don't consider, and how they feel about an embryo and how they feel about saving that embryo or donating that embryo. So these are very challenging things. So one of the coping strategies can be improving communication with partners and learning to communicate in ways where they can express themselves toward their partner without blame, and express themselves and listen in ways where they can hear their partner and get to the point where they can express needs and then make their communication supportive in a way that meets those needs. And a big difference also is like acceptance of differences. Something that the couples might struggle with is that they cope with infertility differently, and really helping them learn how to accept the difference and change what can be changed, but also accept what can't. That can be really powerful at that relational level. And then finally, at the social level, um, seeking support from trusted friends is really powerful, like using those existing social networks. Now, those may have been altered because of all the reasons we just talked about. So, if that is the case, they might expand their social network by connecting with others that are experiencing infertility as well. They may join online communities. There's a group called Uniquely Knitted in Orange, California, which is a nonprofit, and they have online process groups that are led by therapists. They have reduced fees, and then they have a community where people can really get support because they're going through this similar challenge. So I would see that all those coping strategies at kind of those main levels, and if people can access those, there is a lot that people can do to really kind of stabilize that distress.
Oh, these are all so helpful. And I wasn't aware of the three levels. I love that the individual, relational level, the social level. And with the individual level, mindfulness, that's something I learned new. I thought I knew so much about mindfulness. And a lot of us, we focus on being in the here and now, being present. But this goes a bit beyond what you said about it combats the avoidance, turning towards. So the acceptance of as
Yeah.
it is what it is. We can't change it. That acceptance.
One of the very first times I was working with someone as a couple, they came into my office and um, the female partner she was really struggling. She had not talked about infertility with really anyone. And this is so common for people where it just kind of builds and builds and builds. And when they finally enter into the counseling room, there's just so much that they haven't been able to talk about. They feel so overwhelmed. And what she wanted was her partner to feel similarly as she did to the infertility. And he was experiencing it in a different way. What she was doing was she was turning away from the internal like thoughts that she was having about it, any kind of internal emotions, and she was just pushing that away. And like we said, that can work for a little bit of time, but it had gotten to the point where it was counterproductive. So when she started using mindfulness practices and she started just turning towards a little bit, it was painful for her, but it was also helpful because it was, in a sense, the body can release some of that stress when it's not just pushed away. When we bury something, it's going to come out in other ways. It's going to manifest itself. But
Uh,
we know in psychology that when we push something away or when we don't want something to be there, it just gets bigger. And
mhm,
it's a paradox that when we turn towards something, it will be initially more distressing, but
mhm.
then it will lose that impact and we can then cope with it in a much better way. So that was a really powerful lesson to me to see that when she was able to turn towards and use some of that non-judgmental mindfulness and that those exercises, particularly like practicing them at home, like using audio recordings, that was really, really powerful for her.
Yeah, when you bury feelings, because I remember somebody telling me, maybe a life coach, I think there's a book called that, Feelings Buried Alive Never
Oh,
Die.
yeah,
That's so powerful as
yeah,
well. So I loved what you said about all this mindfulness and the journaling. You'd mentioned how expressive journaling for their anger, releasing that, the unfairness of it all, that must
yeah.
hit so hard. Why is it some people can just so easily, and there's those people who are maybe abusive towards their kids, they don't deserve kids, and you feel that unfairness. That's so true. And how important the on the relational level, the partner communication, yeah, that you have different styles of how you're going to accept or cope with this. And you're going to talk a little bit more, I think, later about that.
What each of those things do is they're helping people gain that sense of rootedness, right? They're trying to find a sense of stability, find a sense of balance again in their lives. And where do they find that, right? There's the being uprooted in this sense, it's inevitable. There's no way that people aren't going to feel displaced, derailed, uprooted, but
Mhm.
it's this idea of how they can find a place where they can kind of settle and a place where they can make sense of it.
Yeah, feel grounded again. And also, if you wouldn't mind, if you have any other resources that they could turn to, any groups or online, I can include them in the show notes.
Absolutely.
And then the social side that you mentioned as well. The fact that, yeah, they had their social network, but now they need to expand it. They may not be accepted in that same social circle as before. That's a lot to navigate.
It is. It is.
So many things they need to think about and make changes in their life at all levels.
It's so overwhelming, and that's why it's so their life was kind of going in this one direction, and then they're completely going in this other direction. And it may be for some people, it may be a briefer journey. It may be a journey where they try for a year, they're not able to, and the physicians are able to give them some mild interventions, maybe some medication for ovulation, or there can be some kind of surgery that would correct something that was getting in the way. And then they have a child and it's more of a brief interruption. But there might be someone who goes through treatments for several years, or they go through two, three, four failed treatments. And those are very challenging for people over time. And then at the other end, there could be people who go through this for a number of years. And then in their journey, they get to this place where they're not going to have a child. And that's one of the resources that I think is really good. There's a researcher, Sophia Gamero at the University of Cardiff, and she and her colleagues have come up with a program that people can use, and it's called myjourney.pt. And I'll give that to you and you can put
Hmm.
that in the notes, where it's for people who get to this sense of how do they build acceptance of an unfulfilled wish for children, that they are at this place in life where now they've exhausted their possibilities and their resources, and they're choosing to live a child-free life at this point, and a sense of how do what do you do with that now? And there's a lot of quotes where people say, when when you've planned on having children your whole life and then you realize that you're not going to, then what do you do with your life? How do you make a meaningful contribution? How do you invest your time?
That leads easily onto our next question because I wanted to ask you, how do couples find meaning again when things didn't go as planned? Because it's so disappointing when we have our heart set on something, those expectations are dashed and we're derailed. And you have spoken about some meaning based studies I came across for coping that were really fascinating. If you wouldn't mind sharing those with us as well.
Yeah, the search and discovery of meaning is really one of the most important predictors of psychological health. So when people say that they have a sense of purpose or a sense of meaning in life, it's associated with higher well-being, really across the board. When people are thrown off of that and now they question their meaning and they find themselves embroiled in just a search for meaning, but there is no presence of meaning for people, that's a process that is going to take time. With meaning creation, we know there's powerful benefits from it, but it's also something, because it's a process that unfolds over time. It's not something that as therapists we would recommend at the beginning of the journey, because it's putting the cart before the horse, so to speak. It's asking someone, like, the reason people can get to new meaning is they have gone through these struggles and these stresses, and they've had to learn to let go of certain things, and they've gone through these disappointments, and they've had to develop resilience based upon that. And afterwards, they can get to a sense of, well, what is it that's important to us, and what is meaningful for us? There's a couple ways to get that. And one of the things about meaning creation, it really is a relational process. So if we think about therapy, one of the things that therapy really is helping people create meaningful narratives for their lives, and they're building a coherent story about their past experiences, about what their future desires are, and they're putting it together in a way that makes sense. They're organizing it through a process of sharing it with someone who may reflect it, who may ask them to consider it in this way, have them look at the implications of that way. So that's the power of that, is through potentially, like, storytelling is a way that meaning can be created, is about hearing other people's perspectives, clarifying our own.
That's so true. Finding meaning is so important for mental well-being. I know that personally in my own life through all the major changes I've faced. That's why I have an episode on finding meaning.
Mm,
But they're having to navigate um, creating a new meaning because that was their meaning and it was
yes,
so disappointing.
yes. And the good news is there are ways that people find new meaning. So if nurturing is important to them, they might find nurturing a niece or a nephew, becoming kind of that special relative to someone. Or they may take in international students and mentor that way. They may mentor through a church or a community group. They may find themselves just giving back in certain ways. And that's really powerful for people. Where one quote I even read, where the woman said that my work is my baby. I'm a healthcare professional, and in my nursing, I care for people, I nurture them, and that's where I get my meaning. So there's ways where people, like in Gamero's research with that My Journey, what they found is people who successfully make that journey to childlessness, and then they can become rooted again. Let's say they have like three things. They find meaning through creation, meaning creation. They redefine their life's priorities, and they have new beliefs about the world. So that's a process, like taking time to really challenge beliefs and refine them is significantly difficult to do. But that is something that can be very powerful for people. And when they get there, then they're now rooted in a path that they've gotten through from adversity and from resilience, and that's going to feel much more stabilizing and grounding for them.
Writing a news story for themselves. And you'd mention all these other ways that they nurture that, whether it's looking after, spending time with a nephew or niece or whatever. What I'd love to know is what's next for you, Dr. Peterson? Are there any future research plans in the works that you're permitted to discuss?
Yeah, right now my colleagues and I are working on a study about post-traumatic growth. This is a very interesting area of research that's kind of understudied, but is coming into fruition more. And it's related to, say, meaning, but it's also different. So in post-traumatic growth, it's a sense of when someone goes through adversity, when someone goes through a challenge, it's the growth that is immediately related to that. It's the changes that are immediately because of that. So it's not just meaning creation about life in general, it's about some specific stress that people have gone through. And one of my colleagues from Israel talks a lot about it doesn't have to just be uh, growth. It can be just stress because stress can promote growth for people. So we are looking at predictors of growth for people going through infertility. We have a sample of individuals who we have a baseline, and then we have a sample at 1 year, and we're looking at changes between year one or baseline and year one, and those things that might predict post traumatic growth. So, what helps people to grow? And that's really important because if we can get a nice pathway and understand what leads to growth, then as clinicians, we can help educate and teach them about how they can help people get there. And then just make it available to the infertility community where they can learn about having some more hopefulness towards, okay, there might be something that can come out of this, but here's what oftentimes this is what the journey is going to look like. So it's not a false sense of you're just going to grow because this is challenging and you need to make new meaning at the beginning, but it's a sense of a long-term kind of map about something that can be accomplished, something that can be found at the end.
Hmm. Post-traumatic growth. We all hear of PTSD, post-traumatic stress disorder. We're less familiar with post-traumatic growth, which I have mentioned in one of my
Mm.
episodes as well. As the growth that comes through stress. And there are some people who feel like, oh, we're always being told, oh, just see the positive at the other end and you're going to grow from it. I think sometimes people get tired of hearing that and feeling that, oh, people are putting pressure on them to see the positive. Some people call it toxic positivity. But what I love is that there's real science that you're doing behind this and following
Yeah.
that what actually helps people with the growth, the science behind that. That's so hopeful.
Yeah, I think it's totally different than toxic positivity, which would just
Hmm.
be a denial of things being hard, right? It's just be like everything's going to be great, but there's a sense of this process. People are recognizing their pain, they're recognizing their losses, they're processing these losses, they're talking about these disappointments with other people, they're sharing, they're going through the loss of their network, they're going through something incredibly difficult, but we do know that when people go through adversity and challenge, there are ways in which they come out different people. And you'll talk to many people who have gone through a significant adversity, and usually they will say, I wouldn't do it over again, but I also wouldn't change it because it helped me become the person that I am. Like it forges us in a certain way, and people become this new person, and that has been their journey. And so they don't want to go back and do it differently. They wouldn't recommend it because they know it was incredibly challenging, but there's growth that occurs from that adverse stress.
Yes, it forges us in a new way. Yeah, that is so hopeful. And I'm certainly going to be following your research on that. I find that fascinating. And that's such a hopeful message to leave us on. Dr. Peterson, if anyone would like to connect with you after this, including for speaking engagements, How can they find you or connect with you?
The best way is my email, which is bpeterson@chapman.edu, or they can just look up my webpage, which is from Chapman University, my faculty webpage, and that would be an easy way to get a hold of me.
Okay, I can include those in the show notes as
Great.
well. Brennan, it's been truly a privilege to have you here today. Really want to thank you for being here.
Well, thank you so much for inviting me to be on. It's really an honor to be on your podcast, and I really loved thinking about what it means to be uprooted in the infertility experience. And I think what you're doing is so important for people. They may not be going through infertility, your people listening, but they may be going, obviously, they're going through something where they feel uprooted. And that sense of finding stabilization, finding balance, it's really a huge human need to find a place where we can put those roots, where we can feel connected, whether it's to the people around us or within ourselves. And it's just it's a beautiful thing that you're doing.
Thank you. And I think a lot of what you said, it can be applied, like you said, to other major change, unwanted change as well. Thank you for sharing your tremendous knowledge on this topic. I've certainly learned so much from you, and I'm sure our listeners have too. I'd also like to thank all of you who tuned in. And if you enjoyed listening to today's episode, please share it with someone who could do with this episode. And also, you can join our Uprooted by Unwanted Change Facebook group. I started it really to be as a support for people. So I'd love to see you on there. In the midst of chaos and uncertainty, may you find peace and rootedness.